Good evening. Good evening. Thank you for joining us. And Supreme Fertility is here, and Amanda, and Anshur, and we've got Shannon, Courtney. Thank you for joining us, guys. We're just waiting for a few guys to join us. Amatle, and yeah, it's Wednesday evening, 8 p.m. I get to spend it with you guys. Durande Visser. So we'll just wait for a few more. Debra, I see you there. I will send an invite in a few minutes. Just like to just greet everyone. Thank you for joining us this evening. It's always great to spend these moments with you guys, chat to you, and let me know what's happening. Where are you guys? Are you busy with treatments, or have you decided what you're going to do? Let me know. Inbox me if you want to chat about anything or need advice on anything. If you're not subscribed to our newsletters yet, please visit our website. It's the easiest thing to do. As soon as you get to the website, it will give you a little form that you fill in, and you can actually fill in your details. And yeah, so great to have you all here. Debra, I'm going to send you an invite now to join us. So there we go. Tonight we are chatting to Debra from Supreme Fertility, and here we go. Debra's here. Let's just wait for her to join us. Hi everyone that's joined. This is B, Maleke. Okay. Debra there. Okay. So I'm just going to send it again. Okay, there we go. Hi, Debra.
Hi, Leanne, how are you?
Fine, yourself?
I'm very well, thank you.
Thank you for joining us. So I'm just greeting everyone as they're coming in. So they're obviously all just getting the notifications still. So Debra is from Supreme Fertility. And I just want to say thank you for doing this with us. And tonight's topic is preventing miscarriages. Apologies about the dogs in the background. It's nighttime. So yeah, we're talking about preventing miscarriages as well as preparing for a successful IVF. And these are two great topics, and I'm hoping that we're going to have time for both of them because they're both great topics. So please, without taking any more of your time, please tell us more about, first of all, the preventing miscarriages, and also maybe just introduce yourself and where you're from, and just tell everybody, what it is that you do.
Well, thank you very much. For those of you that haven't met me yet, my name is Debra Langley. I'm actually a pharmacist by profession, but I'm now also the operations and training manager for Supreme Fertility. So I do come from a pharmaceutical background, and I'm looking really forward to sharing a little bit more information, just some of the reasons that might be behind some of the miscarriages and all the failed IVFs and things out there tonight. So I was actually thinking a little bit back a few years ago, in the newspaper, the IVF, the first test tube baby, was like the headline in the newspapers, and it was quite a thing. But today, yeah, IVF is quite common. So there's a lot of people that are trying IVFs, and some are having a lot more success rates than other people. And it's quite a miraculous process when they can actually retrieve eggs and sperm and fertilize it outside of the body and then implant it back into a woman's uterus again. And it's really quite a remarkable and miraculous procedure. But it is quite costly. So those of you that have already tried it, sometimes patients have to go through numerous IVF procedures, sometimes 4, 5, 6, 7 before it is successful. And depending on the whole package that they're doing, it can cost up to like 90,000 treatment, which is very expensive. And I was looking recently at some of the recent literature and things like that is available on success rates, and it does vary according to ages, etc. But we're looking on average at about 32.5% success rates. So there could be many different reasons why these IVF procedures are not so successful, and many things. We could be looking at things like the quality of the embryos, the quality of the eggs, the quality of the sperms, the ovarian response, implantation dysfunction, and even the patient's age is a very important role to play in that as well. And what I did already mention of the sperm quality and things like that as well. But what is really important to know, that I wanted to mention this evening for the patients, is from the moment that the egg and the sperm actually fertilize, the cells start dividing, and this is an extremely complicated process, and it requires an enormous amount of energy. Now, this energy production is produced by the mitochondria in the form of ATP, and there are many factors in a patient's diet and lifestyle, and even certain drugs and medications that they may be using that could affect the functioning of the mitochondria. So it might not actually be an implantation failure even for natural pregnancies and things like that, but it could potentially be that there is at some point in this delicate cell division process that takes place, that there is some kind of interference, or the patient could be will be exposed to certain kinds of risk factors and things like that. That is really quite very important to know. So everything starts with healthy egg and healthy sperm. So if you have an egg that has some kind of DNA damage, or you have a sperm that has some kind of DNA damage, that little embryo that forms is going to have DNA damage. And that could potentially result in miscarriages. It could result in failed IVF cycles, but it could also result in things like trisomy and babies with Down syndrome and other kinds of birth defects and things like that taking place as well. Now, the people always think that egg quality only decreases with age. Now, that is particularly, it is realistic, and it does happen that age is a very important factor, and it can affect the mitochondrial functioning as well. That's why women in their later 30s, early 40s have got such a small window and gap in which to fall pregnant and to optimize everything as well. But what is also extremely important to know is that it's not only older women that have poor quality eggs or things like that, because they've actually done studies on women of the same age. And even in women of the same age, some of them have many eggs with chromosomal abnormalities. Others have only a few, and then some of them have eggs that are completely healthy as well. So that is what are the things that all boils down to: healthy egg and healthy sperm. Now, the quality sperm is something that is quite regularly discussed, because we are often having the sperm tested, and we can look at the shape of the sperm, the morphology and the motility of the sperm and things like that. But a topic that is not commonly addressed would be more the egg quality. And what do we mean by egg quality is that the ability, once the egg has been fertilized by the sperm, can it actually progress and develop into a healthy pregnancy and a healthy baby? And that's really what we mean by egg quality. And only about a third of fertilized embryos actually progress to this stage. So women can have these little recurrent miscarriages all the time, with actually even realizing that they are pregnant in some instances. As well. Okay, so besides various diets and lifestyle factors that could potentially cause this damage and this chromosomal damage to either the sperm or the DNA, having that right number and copy of chromosomes is probably one of the most important factors. And that could be defined, one of the most important things that's so just basically everybody, well, I've already mentioned about the age factor and things like that as well, but what I think I wanted to just address now a little bit is that it's a topic that we actually call aneuploidy, and that is really defined as any kind of deviation from the normal number of chromosomes that a cell etc. should have. Yeah.
Mm.
So there are some of these super smart fertility centers out there, and I don't know if any of you have even actually tried this, but many of them are now offering pre-implantation genetic screening, which is a remarkable advancement. And it's amazing to think that people are planning IVFs and things like that. They can actually now even do biopsies on those little embryos, determine and select those that have no chromosomal abnormalities and implant them back into a woman's uterus, which really helps to increase success rates considerably.
That's exactly what I was just, sorry, I was just going to mention now that you might think, oh, but that's IVF is already so expensive, and you're thinking, oh, do I not really need to have that test? Can't I save some money because it's expensive? But you don't realize is that test could actually save you money in the end. It would help you basically, go from a let's try and get pregnant, let's see if this will work, to you having a better success rate with that one try, and that's eventually, I mean, that's what the end result you would want from doing IV, if you're not having to go it over and over and over.
No,
Sorry.
absolutely. And it really does help to improve the success rates, because I can select those embryos that are chromosomally normal and implant them back. So there's a lot of studies and things done on that. And it was also pioneered in the States by a really, really smart man called Dr. William Schoolcraft. He pioneered this whole process. But what is also quite interesting to know is, for me particularly, is when it comes to this pre-implantation screening, is sometimes people, it doesn't also come free. So there is costs and stuff involved with that as well, and can also be quite costly. So sometimes people have to pay the exorbitant costs for the pre-implantation genetic screening, as well as the cost for the IVF. And sometimes when they do the screening, what they actually find is that all the little embryos have some kind of a chromosomal abnormality. And that is a problem, because what can you do about it then? There's actually nothing they can do about it. So when people actually understand that, you can realize why there are so often failed IVFs. And that's probably, when we're getting onto the topic of miscarriages as well, it is probably one of the most important reasons for failed miscarriage is that of genetic abnormalities and things like that in the little embryos that actually can occur, and that do occur. So if you particularly, we were speaking about the quality of a woman's eggs, and once again, when it comes to age, a woman over 40, more than about 50 to 80% of their eggs can have some kind of a chromosomal damage. And younger women as well, when you're looking at women younger than 35, 1 in 4 eggs can also have some kind of a chromosomal abnormality. And just to explain this, that particular egg that has a chromosomal abnormality could be the one that the woman ovulates that particular month, and it could be fertilized by the sperm, and that could be resulting in a miscarriage or some other kind of problem as well, your trisomy or your Downs, etc. So they actually did a study in a couple of years ago on about 482 Japanese women that they had looked at in the study, and about all with failed miscarriages and things like that as well. And what they actually discovered was that 41% of these women had some kind of a embryonic karyotyping in their makeup, well, in the embryos. They were genetically abnormal. So what kind of things could be causing this kind of damage to the DNA of the egg and the sperm, or affecting even mitochondrial function at some cases? So you're looking at a lot of toxins. So what we really do at Supreme Fertility is we don't do pre-implantation genetic screening and things like that. We actually take a step back completely, and we take a look at the DNA of the husband and the wife to identify genetic risk factors that could be increasing risks for certain conditions. So it could be, for instance, oxidative stress is a very important thing that can damage the DNA of both the egg and the sperm as well. And there are certain genetic variations that could increase a patient's risk for doing that. So we do identify not only the genetic risks, but we will take a look at the patient's diet and lifestyle as well, because that also has to be cleaned up, because there are many factors on a daily basis that could be affecting that as well. So then it all comes together in a nutshell, because we not only have to avoid the risk factors for the potential damage, but we've also got to provide the right kind of nutrients that comes through diet and the right supplementation and things like that to create this whole optimum fertile environment to ideally allow people to fall pregnant naturally. But even in doing so, it does help to prepare patients for a potential IVF procedure as well, because it doesn't really help going for an IVF procedure if they are going to retrieve eggs and sperm that have some kind of a DNA damage.
Yeah.
So I think your money is going to be a lot better and well spent if you prepare for that procedure. So in other words, give yourself 3 to 6 months, clean up your diet and your environment and your lifestyle, and use the right kind of supplements before they even retrieve your eggs and sperm in the process.
Yeah.
So
Tell me what I know you guys have some type of you've got a few different products that you have. Do you have some type of kit? I know it's this like a starter kit thing that you guys have with different vitamins and stuff, but you also got another kit where I don't know if you take a swab. Could you tell me about that kit that you have?
Sure. Our complete program is called the Supreme Fertility Program. So we really do, it includes a DNA testing of both the male and the female to find those genetic risk factors. And it's really a very quick and easy and simple process. We simply collect a DNA swab from inside the mouth, and it gets put into a test tube and goes off to the lab. So there's no blood or pain or pricks or anything like that involved. And that usually takes about 3 to 4 weeks for those results to come back. And then we've also got a fertility pack that we've compiled after a lot of research, etc. And it includes 3 particular or supplements in total in the fertility pack. And the one is a folate. So we've got now the new 4th generation folate and myo-inositol in that product. We've got a multivitamin to support overall reproductive health as well, and then an antioxidant and amino acid supplement that also helps to prevent all that oxidative stress damage. So it is 3 products in total, but we do try and cover the whole aspect of this fertile environment that needs to be addressed. And then of course everything comes together in that consultation where we address the diet and the lifestyle and have a look at potential blood work, etc., that could need to take place.
Wow. Okay, so there's quite a lot. I mean, it's a question that we get a lot. It's like, going for IVF, what can I do? And it's a very difficult question to ask because everyone is difficult. Everyone is different. So I can't just say to Ma'am A, no, take this product. This product is going to help you. And the best is to actually go for the consultation, speak to someone, and they can advise you. And depending on the results that you find. So, and also the products that you have. I know you can purchase the products on our website, and you can actually contact Debra directly and speak to her, and actually go to the Supreme Fertility website. But Debra, carry on. Sorry, if there's anything else you want to say to us?
Yeah, just one more thing, talking about the DNA again, what I did want to comment as well is what studies have shown as well, certain people have genetic variations that could increase risk for things like miscarriages, that could increase chances of having PCOS or endometriosis, that can also affect your fertility as such as well. But the nice thing that we do is all the DNA that we do test for, we can do something about if there are genetic variations. So by either changing a patient's diet, or optimizing the diet or lifestyle, or recommending the right kind of supplements, we can support those genetic variations that we find. So we do only look at things that you can actually do potentially do something about to help improve the DNA. And
I was actually going to. Yeah, sorry, I was going to ask that actually. If once you found the results, like, you would be able to assist them and say, okay, this is your next step of what to do.
Yes, absolutely. So we do that. And it's a question that people always ask me as well, will my DNA change? And that's it's a question that often comes up, and no, your DNA will never change, because the DNA you have is the DNA that you're born with, and you have it for the rest of your life. But your DNA you place inside what we call an epigenetic environment, and that environment is made up of things like your diet and your lifestyle and drugs and supplements, etc., and toxins that you're exposed to, and that can affect how your your DNA expresses itself. So we really do need to pay attention to what we're doing with our bodies and our health, and where we placing our DNA under stress, etc., and those kind of factors. So definitely in a whole can be look, one of the reasons to help prevent further miscarriages. It could help to improve your IVF success rates. If you have been unsuccessful at having 3 or 4 failed attempts, this is definitely something to consider, and maybe think about starting with better quality egg and sperm to begin with.
Okay, Debra, can you at least can you just give us your contact details? So if they want to contact you, speak to you, can you just give them your details, please?
I'm sure. Our website is www.supremefertility.co.za, and they're welcome to just drop me an email directly as well. My email address is support@supremefertility.co.za, and I'll gladly get back for them. We do work through, what I wanted to mention as well, we do only work through registered healthcare practitioners. So they will find a list of these people on our website, or they can contact me directly, and I'll put them in touch with the person closest to them. That's so yeah. So
you're all over South Africa, and if we have quite a lot of women that are actually in neighboring African countries. How would you assist that woman?
Well, depending on the country, so they can definitely contact us, and we can just liaise with them and find out if it is possible. But we've definitely had a few patients that have sent in some samples from neighboring countries. So it's literally the consultations and stuff that we would have with the patients if we don't have a practitioner in the area is via Zoom. So that's pretty much what we're doing now. The amazing thing that technology allows us to do, so you can really reach people in really remote and outlying areas and assist them there as well.
Yeah. Okay, perfect. Thank you very much. So if those of you that are planning on doing IVF, and you actually want to save yourself some money, instead of doing a whole lot of treatments, and you're going to actually get those eggs, and then finding out in the end that nothing has worked. So please go and contact Debra as Supreme Fertility. Contact Supreme Fertility, and I'm sure they'll be able to assist you in doing the relevant tests and stuff. And prepare yourself for IVF. Don't just walk in, go for it. Instead of prepare your body for it, your mind and your body at the same time. So thank you very much, Debra. It's always lovely having you, and it's nice that we get the we get both sides from you when it comes to Supreme Fertility, because you're a pharmacist and you understand how these things work, but you've also dealt with some of these things yourself. So thank you very much for that. We hope to have you back soon.
No, thank you for inviting me. It's always great to partner up with you and be part of your whole network, because it really goes about helping people have healthy babies, which is what we really want to do. So yeah, thanks so much for having me.
It's a pleasure. Have a great evening, Debra. Thank you. Bye.
No, thanks, and keep well. Bye bye.
You too.